Assalamu alaikum. This is one black man's opinion. My beloved brothers and sisters, KHOU Channel 11 reported that 50% of all of Houstonians that have died from COVID-19 had diabetes. They also reported that the Houston Health Department says that 13.5%, or 311,118 of the 2.3 million Houstonians have diabetes. Question is, why haven't we declared diabetes an epidemic? Now, the risk factors as it relates to COVID-19 are influenced by age, race, education, income, chronic conditions, and behaviors such as obesity and smoking, and social and economic factors as housing and poverty. Now, according to the U.S. Department of Health and Human Services, the Office of Minority Health, listen to these statistics as it relates to diabetes in African Americans. In 2018, non-Hispanic blacks were twice as likely as non-Hispanic whites to die from diabetes. African American adults were 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician. In 2017, non-Hispanic blacks were 3.2 times more likely to be diagnosed with end-stage renal disease as compared to non-Hispanic whites. And in 2017, non-Hispanic blacks were 2.3 times more likely to be hospitalized for lower limb amputations as compared to non-Hispanic whites. Now, they list on this website, in terms of diabetes in African Americans, the risk factors are, listen to these: obesity and overweight, hypertension, high cholesterol, and cigarette smoking. And when you go to heart disease, which relates also to cigarette smoking, it says in 2018, African Americans were 30% more likely to die from heart disease than non-Hispanic whites. Although African American adults are 40% more likely to have high blood pressure, they are less likely than non-Hispanic whites to have their blood pressure under control. African American women are 60% more likely to have high blood pressure as compared to non-Hispanic white women. And as it relates to obesity, it says that African American women have the highest rates of obesity and being overweight compared to other groups in the United States. About 4 out of 5 African American women are overweight or obese. In 2018, non-Hispanic blacks were 1.3 times more likely to be obese as compared to non-Hispanic whites. In 2018, African American women were 50% more likely to be obese than non-Hispanic white women. From 2013 to 2016, non-Hispanic black females were 2.3 times more likely to be overweight as compared to non-Hispanic white females. People who are overweight are more likely to suffer from high blood pressure, high levels of blood fats, diabetes, and LDL cholesterol, all risk factors for heart disease and stroke. In 2018, African Americans were 20% less likely to engage in active physical activity as compared to non-Hispanic whites. When you look at the CDC website for National Diabetes Prevention Program, to summarize it, it boils down to this: to increase activity or exercise, to eat well, reduce stress, set goals for yourself, pledge to keep them, and stay motivated. This sounds like a lifestyle change to me. Not a Deathstyle change, but a lifestyle change. Now, what I want to say is this. There seems to be this big emphasis on vaccines, vaccinations, but nobody's talking about changing the lifestyle. Stop smoking. Learn how to eat to live. Now, learning how to eat to live, because it comes from the most honorable Elijah Muhammad and is promoted by the Honorable Minister Louis Farrakhan and the Nation of Islam, many of you are turned off by that because you say, well, I'm not into this Muslim religion thing. Well, our lifestyle is not just related to Muslims don't eat pork. Yes, it's about what we eat and what we don't eat, but it's also about when we eat and about what we don't eat in terms of fasting, which now they call intermittent fasting. We've been taught this since the 1930s. It's much more than what's halal. In How to Eat to Live, it talks about the consumption of alcohol, the consumption of tobacco products. It talks about how your kitchen is a greater healer than your medicine cabinet and pills and drugs can ever be. So, our advice to you, our admonition to you, our exhortation to you, our plea to you is let us now come and reason together. And let us put an emphasis on changing our lifestyles, because it appears that how we live is how we're dying. And if we would change our lifestyle, our quantity of life and our quality of life will change for the better. My brothers, my sisters, our love for you is such that we have to tell you the truth. There is a plot, if you will, to make money off of our pathologies. People don't seem to want to prevent crime, prevent these health disparities, prevent the wealth gap, prevent the educational gap. People don't seem to want to do the things that prevent the prison industrial complex from filling up with our sons and daughters. They don't want to seem to do what's necessary to prevent drug and alcohol addiction and abuse. They don't seem to want to do that which prevents the kind of problems that come about that manifest themselves in what one would call mental health issues or mental illness. They don't seem to want to prevent domestic violence by dealing with the root causes of things. They don't want to go to the root cause of things. They seem to want to treat things, make money by treatment instead of prevention. I'll give you this analogy before I close. If you left your house and then you came back later and you found water on the floor, what's the first thing would you do? Would you go get a bucket and a mop and start mopping up the floor? Or would you go find out where that water was coming from? And if you found out that in your haste to leave the house, you left the sink running, and in the sink was some dishes and a dish rag that got stuck in the drain. Again, would you go back and start mopping up? Or would you turn off the faucet, then unstop the drain, and then get the mop and clean up? What we do, how we do it, and when we do it will determine the effectiveness and the sustainability of our success, our victories, and our outcomes. If we want to prevent more deaths from these opportunistic viruses and bacteria, we need to change our lifestyles from death styles. Brothers and sisters, choose life over death. Let's get active. Let's learn how to eat to live. Let's make our word bond to ourselves as we approach this new year. Don't say you're going to lose weight. Don't say you're going to stop smoking. Don't say you're going to live a better, healthy lifestyle on January the 1st. And then on January the 3rd, you go back and break the promise to your own self. It's time to choose life over death. This is one black man's opinion. What's yours? I'm Brother Abdul Halim Muhammad. Assalamu alaikum.